Nearly every physician these days is feeling at least some effect of a big problem in medicine: nursing turnover. The problem seems worse in hospitals, where 1 in 6 nurses changes jobs every year. But the challenge is universal. One study found that nurses are 5 times more likely to experience job dissatisfaction than workers in general. In a healthy economy, that translates to nurse coming and going constantly. In turn, constant turnover can breed clinical inefficiencies, lower quality of care, and doctor frustrations from having to train and adapt to new clinical personnel. So what can doctors do about the nursing merry-go-round? Of course, much depends on whether you're an employee physician in a hospital or health system or provider group, or a shareholder in or owner of a private practice. Either way, doctors can frequently influence human resources policies, if not direct policies themselves. If you're an employee physician, consider your leverage with management and how the role of nursing affects patient outcomes. Look for specific examples of increased clinical risks due to nurse turnover and draft a list of real-life instances to take to higher-ups. Better yet, you might consider enlisting physician colleagues in the writing of a formal letter to management. Naturally, the task becomes a little simpler for a practice owner or a shareholder. But sometimes this creates another problem. In a small to medium-sized provider group, how much can you afford to pay to keep good nurses? Here's where I suggest shifting your mindset. Recruiting and keeping good employees is not a cost. It's an investment, regardless of where you practice medicine. The right staffing will improve clinical performance and earnings, allowing doctors to do only what they can do and therefore see more patients. Furthermore, consider the cost of replacing a single nurse, which estimates say run anywhere from about $22,000 to $64,000. Clearly, this kind of cash can go a long way to alleviating turnover. Nonetheless, I'd like to warn you about a very common trap in management: the knee-jerk tendency to simply hand out raises to nurses like candy. Anecdotally, I've heard of hospitals awarding nurses in acute care units as much as 30% bonuses in a healthy job market. But remember, underpayment is not always the main source of nurse burnout. Rather, poor management, compassion fatigue, irregular work hours, and stressful work environments can be equal or larger culprits. In this context, let's look at complaints about poor management, which more often than not stem from 2 shortcomings: lack of clarity of each employee's roles and responsibilities, and clear communications among work groups. For the former, carefully crafted organizational charts and job descriptions can go a long ways in ensuring each employee knows management's expectations. In addition, regular employee performance reviews reinforce those expectations. As for clear communications among coworkers, one of the best tools I've seen comes from the software world, where computer programmers hold an informal daily or semi-daily meeting called a scrum. Scrums are mercifully brief, 10 to 20 minutes is typical, and are held first thing in the morning with everyone standing to keep them short. The team quickly previews the day ahead and chats about any special challenges, urgencies, and trends needing attention. Usually, the small investment of time up front more than pays for itself in advance of mistakes and do-overs. Another common complaint about management is inadequate staffing. One study found that increasing the patient-to-nurse ratio in hospitals by just 1 patient increases the risk of nurse burnout by 23% and of job dissatisfaction by 15%. For this, I suggest researching average patient-to-nurse ratios and relating nursing workloads for your clinical situations in hopes of applying a scientific baseline to staffing decisions. In addition, strive to keep nursing work schedules as regular as possible. A common grievance from nurses is over constantly changing shifts, particularly at the last minute. Another foe in the battle for nurse retention is compassion fatigue, particularly in acute care. Some healthcare employers have made gains in this area by providing employee assistance programs and paid gym memberships for nurses in the objective of improving health of both mind and body. Lastly, nurses often bemoan a lack of career advancement as a factor in changing jobs. A good way to counter this complaint is through designing a robust program in continuing professional education, as well as offering some form of tuition reimbursement for nurses pursuing more formal education. As an employer myself for many years, I know that some employee attrition is inevitable, At the same time, my own experience has taught me that even modest investments in employee satisfaction and sense of job fulfillment can go a long, long ways in building and keeping the best team possible.